questions.
Thanks, Mr. Chairman. Thanks, Secretary, for being here. Good to see you again. Can we just talk a little bit about consolidation in healthcare and specifically provider consolidation? Is this a problem that needs to be addressed?
Is provider consolidation?
Yes.
Any consolidation which isn't for the purpose of efficiency should be a problem.
So do you think that we should even preserve independent practices at all?
Should we preserve? That's something we've had forever. There's no reason why consolidation should mean that there shouldn't be independent practices.
Okay, fair enough, and I'm glad you feel that way. And I personally think the presence of independent physicians is an invaluable counterweight to the rise of consolidation that we see in our healthcare marketplace. So what is this administration doing to help preserve independent practice as an option for physicians and patients?
Congressman, we continue to work within the industry to make sure that no consolidation is occurring for monopolistic purposes. We work with the Department of Justice on that. We try to keep prices competitive. I would probably agree with you if you were to ask me if removing those independent practitioners is going to lead to higher prices, and I would probably tell you it absolutely does.
And may I just add, it's going to lead to worse patient care, and that's really what we should be concerned about. I mean, it's one thing to spend a lot of money. It's another thing to spend a lot of money and not deliver the care that people really need. So let me just ask you this, because we got the physician's fee schedule coming up. It happens to us end of every July, and then I start getting the letters in October. So would you consider modifying the upcoming physician fee schedule so that it does not involve the large budget neutrality adjustment and offers physicians stability in contrast to many decades of disruptive payment rules?
Here I'll say, Congressman Burgess, I think, but I hear a question from Dr. Burgess, and what I would say to you is that's a dance we have to engage with together because, you know, Congress set the rules, the new budget neutrality rules we have to follow, but more than willing to work with you because, again, if it doesn't really deal with the reality of what the practitioner on the ground has to face, we all should take a closer look.
Well, here's the problem. We need to ensure that this year's physician fee schedule doesn't continue the cycle of large budget neutrality adjustments that drive conversion factors down for providers. And you think that we can do that?
We are more than willing to work with you because we know that there are a lot of providers,
okay. I'll
doctors.
give you the benefit of the doubt. That's a yes, and we will work with you. So, look, we got a problem with, you know, Affordable Care Act, the CMMI was supposed to save money. It doesn't. Poorly constructed models favoring large health organizations, consistent disruptive payment rules driving consolidation. What we just heard this week about the Change Healthcare problems driving consolidation. It seems intuitively obvious to the casual observer that this administration prefers larger healthcare systems and neglects smaller providers. For example, why hasn't this administration embraced ideas such as site-neutral payment reform to lower costs for the patient and reduce consolidation, something that has been included in presidents' budgets for over a decade?
Congressman, probably a longer conversation, but I'd be more than willing to discuss with you the ways that we have continued to try to sustain the smaller providers because the smaller providers are typically the ones that are in rural America. They're typically the ones that are in lower income America, and we desperately need to keep them in place. And so we have promulgated a number of policies that support smaller providers. We want to avoid them being gobbled up by the big guys.
Okay, here's a pro tip. Site neutrality can replace budget neutrality. We can afford this. We have the dollars within the system. We can afford to do this. It is just the will to deliver on that. There's a big increase in the budget for this year. We're 3 years now post-COVID, and the budget is even bigger than what it was when you all came in 2021. I appreciate your acknowledgement of the prior administration, Operation Warp Speed, providing you the platform of vaccines that did allow for the disruption of the coronavirus. But ultimately, we've got to put the well-being of America's patients first and foremost. Just one last thought, and I will submit a number of questions for the record. Do we have any idea what is the cost per enrollee in the Affordable Care Act now?
Again, that would depend on the plan that they purchase. what their income level is, what the level of subsidy would be.
But you say that the care is basically costless to Americans, but it's not. Americans are paying this bill, and now they're paying highest interest rates on the money they're having to borrow for what you're giving away. Thank you, Mr. Chairman. I'll yield back.
Thank the chair, yields back, and the chair will recognize Mr. Sarbanes for 5